So as we get into the cold and flu season, we're learning about RSV with the head of infectious disease services at St. Joe's in Hamilton, Dr. Zain Chagla. And so great to have Dr. Chagla on the show because we're always in a screen for the longest time, like going way back to the pandemic. We never got to see you in person very much. So it's good to see you. I know we're Raptors fans together. We watched the Raptors games last night. We have a lot of interest together, but we've always appreciated your honesty with things and your knowledge. So let's talk about RSV. Because RSV it's been around, but it's kind of coming into the light. What exactly is it?
So RSV, or respiratory syncytial virus, is a respiratory virus similar to influenza, COVID, the other respiratory viruses that usually cause illness from October to January and February of the year. This one is really unique, though, because it affects two populations really significantly. One is young children under the age of 1 year, where, a couple years ago we saw this real rise in healthcare utilization after the pandemic from this. But again, every year we see kids hospitalized for this. But it also affects older individuals, and particularly those over the age of 65. Can lead to pneumonia, can lead to hospital complications. And, comparing it to influenza in a given year, we actually spend about the same amount on it for every year. And in fact, if someone ends up in the hospital with RSV, it's about the same prognosis as influenza. People can do really poorly with this virus as well.
What are some of the symptoms of it?
So similar to other respiratory viruses, fever, chills, cough. Cough is actually a very predominant symptoms because it irritates the lower airways and really causes a significant amount of cough. And then people can be left with, lethargy, can get frailer, especially older individuals that get this virus. And we also can see that this virus can tip off chronic diseases. So people that have heart conditions, lung conditions, can often make them a little bit worse as they recover from them.
There was a recent survey for Ontarians how low knowledge there is of RSV, because even to speak for me, I just clump a lot of things into the flu. Everything's kind of into influenza. Yeah, there's COVID, obviously, because COVID is still around there. And we're seeing COVID all year round, not as much into influenza season. Why is that? Yeah,
I mean, COVID we all know about because it was just part of our history, right? The last 5 years. Yeah. We test for it. We hospital systems were built around it the last few years. Influenza, similarly, we have a lot of knowledge because of the fact that we have an influenza vaccine campaign. We test for it in hospital. And so we really try to educate the population around it to be practical. RSV has had no solutions for the last 100 years. And in the last couple years, we have actually some really important interventions to help prevent RSV. And so this is where the public knowledge really hasn't been there because we haven't talked about it, because we really haven't had anything to offer for it. But at the end of the day, it is actually something that is as bad as influenza to the healthcare system. And now we actually have preventative options for it.
Yeah, because we're getting into the season because it kind of starts now and into November. Is it putting a strain, or will it put strain on hospitals?
Yeah, absolutely. I mean, I think if you look at the three viruses over the last 2 years that have landed people in hospital, it is influenza, COVID, and RSV. So, and October to January, February is the season we see it. We see, again, younger individuals, we see older individuals, we see individuals who have recovered but then have their underlying conditions get worse. And so, absolutely, it's part of the big three that cause hospital strain, and absolutely it's one we have to have more knowledge about for the population to understand why it's still an important virus out there.
We just had flu shots coming out yesterday. Is there a vaccine for RSV?
Yeah, so there are two different vaccine programs for RSV. One for older adults, where they vaccine given once that has at least 3 years of effectiveness, keeping people out of hospital 80% of the time. So really, really important for that, and can help prevent RSV in the long term. And we actually have now a pediatric vaccine program. So either pregnant individuals or babies when they're born will get a vaccine to RSV. And so, hopefully, again, the awareness of this and the benefit of a lot of interventions of this can really, really help reduce the burden of RSV on the healthcare system going forward.
Lastly, is there anything else we should let our viewers know about RSV as we enter cold and flu season?
Yeah, absolutely. So older individuals, pregnant individuals, young children, parents of young children, all of them should be asking their healthcare provider about RSV. Because again, the awareness that there are interventions available, that this is a disease that we can keep people away from healthcare and let them have really, really normal outcomes from, is there. It's changed. It's actually really, really impressive that we've had this over the last couple of years. And so, for this to work, it really involves patients engaging with their providers and taking these options forward.
thank you for always answering our calls. Because we do call you a lot when we have questions. And it's great to have you in
thanks
studio.
for having me. Yeah.
Dr. Zain Chagla, who is the head of infectious diseases at St. Joseph's Healthcare in Hamilton. We'll hook this up with our website. Very important information as we enter cold and flu season. CACH.com/morninglive.